Hello everyone, welcome to Post-COVID19 Public Diplomacy Forum, which is being broadcast from Seoul, Korea on YouTube Live and Zoom conference. I am Professor Eun-gu Ho, the Director of Asia Pacific Research Center at Hanyang University. Hosted by the Ministry of Foreign Affairs of the Republic of Korea, this forum proposes to initiate a public diplomacy platform for public-private health cooperation in Asia. In this webinar, we have eminent experts in the field of health and medical from 5 Asian countries, such as Philippines, Thailand, Indonesia, Uzbekistan, and South Korea. They will present their country's experience and lessons in coping with the COVID-19 pandemic, and also share with us the ideas on how to build up regional health cooperation in Asia. For our forum, Mr. Jae-bok, Ambassador for Public Diplomacy and Deputy Minister of Foreign Affairs of the Republic of Korea, and Ms. Sunwoo, a member of the National Assembly of the Republic of Korea, send us their welcoming and congratulatory remarks.
Excellencies, distinguished guests, ladies and gentlemen, on behalf of the Ministry of Foreign Affairs of Korea, I'd like to extend a warm welcome to all the distinguished participants in today's Post-COVID-19 Public Diplomacy Forum. Thank you all for taking valuable time to join us today. Since earlier this year, COVID-19 pandemic has brought an unprecedented crisis and multiple challenges across the globe. It has also forced governments around the world to fundamentally change their policy priorities and practices in various fields, including public diplomacy. Turning this crisis into a momentum to make public diplomacy more relevant, we have been arranging a variety of virtual events, just like today, to meet and communicate with people of the world. I believe that in this time of uncertainty and fear, public diplomacy can help the public stay connected by empowering them with knowledge, information, courage, hope, compassion, and a sense of global solidarity. As you know well, Korea was one of the first countries hit by COVID-19, but it would be safe to say that Korea is currently managing the virus in a relatively stable manner under the current trend of confirmed cases. Korean government has effectively responded to the COVID-19 situation through 3T strategy, test, trace, and treat, based on openness, transparency, democracy, and civic participation. Moreover, Korea has placed great emphasis on sharing relevant information and practices with other countries, as well as ensuring equitable distribution of COVID-19 vaccines. According to 2019 Global Health Security Index, 6 Asian countries, such as Thailand, Korea, Malaysia, Japan, Singapore, and Indonesia, ranked within the top 30 among 195 countries in the list in terms of health security. Such indicators show that we have created a condition conducive to developing practical cooperation in preventing and responding to epidemic diseases at the regional level. Against this backdrop, this forum is held to promote health security cooperation across the region by sharing experiences and insights from the experts on how to cope with infectious diseases in the post-COVID-19 era. I hope that this forum will provide an opportunity to explore ways to build a better and more resilient society in the spirit of solidarity and cooperation. Before closing, I'd like to thank all health medical experts and healthcare workers for their hard work and dedication to combating the pandemic. I wish you all to stay strong and safe. Thank you.
It is my great honor to offer my congratulations on the holding of this very meaningful online forum on international health cooperation to address the very pertinent task of countering infectious disease, including COVID-19. As a member of the National Assembly, I extend the warmest of welcomes to all participants, including the distinguished medical experts from all around the world. We are so delighted to have you all here. In the face of threat posed by the COVID-19 pandemic, we have gained an even deeper sense of the importance of cooperation at the international level. The National Assembly of the Republic of Korea has been playing a crucial role in promoting international health cooperation. To prevent the spread of the epidemic and support the government's health policy, we are adopting and improving necessary laws and budgets in addition to monitoring government affairs. I trust that this forum will provide a wonderful opportunity to further cultivate our ties of cooperation and also nurture closer collaboration to counter the COVID-19 pandemic. Thus, I stand ready and willing to render full support for the development of this forum into a regular channel for international health cooperation in the future. I wish to extend my appreciation to the co-organizers and also initiators of the events, the Asia Pacific Research Center of Hanyang University, and the newly established organization of the Global Association of Networks for Innovation. I pray for your every success in your meaningful endeavors. Thank you very much for your kind attention. Thank you.
Thank you, honorable guest, for your inspiring words. This is the end of opening, and we'll move on to the first session without a break. Now we start our session 1, whose theme is Cases of International Medical Cooperation to cope with COVID-19 and the future of global health cooperation. In this session, we have 5 distinguished experts. Our first session will be initiated by the key presenter, Dr. Youngmee. She is working actively as the Korea Foundation's Special Representative for Health Diplomacy, as well as a member of WHO COVID-19 IHL Emergency Committee. Government and People Tuichev, Director of Tashkent Medical Academy, will share with us lessons from Uzbekistan's response to COVID-19 pandemic.
Good afternoon. I'm Youngmee, Special Representative for Health Diplomacy for Korea Foundation. It is my great pleasure to join Post-COVID-19 Public Health Diplomacy Forum to strengthen public-private health cooperation in Asia. I'm going to talk about international health cooperation in Asian region during COVID-19 crisis and beyond. Let me just share my slide with you. So if you see the history of pandemics, there are other diseases like plague, smallpox, Spanish flu, which caused huge number of deaths in human history. You can see COVID-19 here now with over 1.2 million deaths, but number is still going up, and we do not know what number we will see at the end. Now, obviously, we are much better prepared with COVID-19 compared with Spanish flu 100 years ago. We do have global governance to deal with emerging diseases and power of science such as testing, vaccine, and treatment options, and also public health measures such as advanced contact tracing. So let me start with the global governance for responding to emerging infectious diseases. The WHO has international health regulation revised in 2005, effective from 2007. We can establish emergency committee, and latest one is COVID-19. So a committee can advise WHO Director General to declare public health emergency of international concern. And all member states should report any possible public health emergency event to WHO within 24 hours. So there were 6 occasions of public health emergency international concern declaration by WHO. Swine flu in 2009, polio in 2014, Ebola in 2014, and Zika 2016, and another Ebola in 2018, and latest one, COVID-19, in 2020. It also operates voluntary joint external evaluation. This is usually the interministerial efforts by the government in collaboration with WHO, OIE, and FAO. And in Western Pacific region and Southeast Asian region of WHO, there is bi-regional Asia-Pacific strategy for emerging diseases, revised in 2017 to advance implementation of IHR 2005. So here is the monitoring and evaluation framework. So there are 4 components of IHR monitoring evaluation framework. The first one is mandatory state party self-assessment annual reporting, and the 3 voluntary component, after action review, simulation exercise, and external evaluation. And from 2016 to 18, 100 countries were evaluated by JEE, and perhaps more in 2019. And I think those 3 voluntary components of this framework should be mandatory to further strengthen the public health capacity at national, regional, and global level. So I want to explain Asia-Pacific strategy for emerging diseases revised in 2017. And this is a 3-in-1 common strategy for countries to strengthen national capacities required for managing emerging diseases, and also developing IHR core capacities and strengthening basic capacities required for pandemic preparedness and response. And this version became more relevant to both developing and developed countries. And it is aiming at enhancing and sustaining core public health functions for entire health systems, and providing linkages to other sectors and health security initiatives on public health emergencies such as bioterrorism, vaccine preventable diseases, chemical and radiation events, and water and food safety issues. And also it is positioning in a broad context of health initiatives such as universal health coverage, One Health, climate change, gender equity, and human rights. This shows the vision, goal, and 6 objectives of APSET 3. So you can see those 6 objectives here: preparedness, risk reduction, early detection and assessment of outbreaks, and rapid response, partnerships and financing, and prevention through healthcare. Here I want to show some details of JEE and Asia-Pacific strategy for emerging diseases. So on the left-hand side, you can see the 19 evaluation tools of JEE. On the right-hand side, 8 focus areas of APSET. So I wanted to highlight the tools which are more relevant to APSET as red box. So overriding purposes of APSET 3 to provide a strategic approach to guide collective efforts of member states, WHO, and partners in implementing IHR 2005, and also to ensure financial sustainability and protect the health of people in Asia-Pacific region. So I want to summarize lessons learned from COVID-19 crisis. Firstly, a public-private partnership is a key success factor in Korea. For example, pharmaceutical companies and Ministry of Food and Drug Safety to produce testing kits, and massive testing in private sector labs. And past experience is very critical. So MERS-SARS experience has been very valuable in Asian countries, and Ebola experience in African countries. So current and ongoing experience with COVID-19 can be utilized for future unknown emerging infectious diseases, so-called disease X. And international solidarity and cooperation based on multilateralism is important to facilitate development and distribution of vaccines and therapeutics, and to ensure global equity. And close collaboration for public health policies to achieve universal health coverage, and for responding to COVID-19 crisis in Uzbekistan, Kazakhstan, and other countries provided very valuable opportunities for international partnership. Here I want to emphasize the role of developing country vaccine manufacturer network to produce COVID-19 vaccine at the global level. It is quite clear that all vaccine manufacturing capacities, including this network, should be fully utilized to produce enough quantity of COVID-19 vaccine as quickly as possible. And I know some members of this network will work with global farmers to locally produce COVID-19 vaccines. But I think we will have to work together to further improve the vaccine production capacity in this network. So new action-oriented global health governance called Support Group for Global Infectious Disease Response was proposed in May. The Minister of Foreign Affairs Korea highlighted the need for global solidarity based on multilateralism for developing vaccines as a global public good during UN General Assembly this year. And also President Moon proposed Northeast Asian Inter-Country Alliance for Public Health during UN General Assembly. And I think this is very timely. And in line with that, I want to propose Asia-Pacific Alliance for Infectious Disease Preparedness and Response, following the model of European and African CDC. And I think this alliance can support implementation of APSET-3 and IHR monitoring and evaluation framework in partnering with the WHO. And this framework can deal with many aspects such as surveillance and lab, human resources, public health training, and research and common data sharing platform. And there should be targeted country support and outbreak response in collaboration with WHO country and regional offices and other partners. And tailored approach would be needed to meet sub-regional need. And I think there should be basically public-private partnership and WHO engagement is needed. So the COVID-19 will not be the world's last health emergency. There is an urgent need for sustainable health emergency preparedness to deal with the next one. So many global health partners are working together to exit from this crisis. And with the fast-moving pandemic, no one is safe unless everyone is safe. And the best time to prevent next pandemic is right now. Thank you very much for your attention.
A pleasant day to all of you, ladies and gentlemen. It is my pleasure to participate and share insights in this post-COVID-19 Public Diplomacy Forum hosted by the Ministry of Foreign Affairs of the Republic of Korea and co-organized by the Asia Pacific Research Center at Hanyang University and the Institute for Occupational and Environmental Health Affairs at Korea University. Today, I will discuss the Philippine perspective on COVID-19 and the role of future global health cooperation on this pandemic. In February 2, 2020, the first case of COVID-19 was reported in the Philippines. It took a little more than a month before the infection eventually spread throughout the country. As a result, a state of public health emergency was declared and community quarantine and lockdowns were implemented on March 15. From the time of initial detection until November 3, the total number of cases has since risen to 385,400. Among these, 29,301 are still active cases, while there are 7,269 deaths registered. Since the peak in August, cases and deaths from COVID-19 has been in a downward trend in the Philippines, and we hope that this will continue to go down in the coming weeks. In order to control the spread of COVID-19, we developed a set of comprehensive strategies. Capitalizing on the lessons learned during its early response phase, the Philippines embarked on the development and implementation of a revitalized COVID-19 Unified Strategy Map called the Coordinated Operations to Defeat Epidemic, or CODE. The CODE operationalizes a national government but local government-led and people-centered response, with health being the center of the approach. While the general strategy also supported policy-making efforts of the national government, it also enabled local government units to receive necessary assistance, especially those with limited resources and those with high caseloads. There are also partnerships fostered with the private sector, including at least 26 private companies and organizations to aid in the response. The Unified Strategy Map highlights the focus of the Philippine government to reduce cases, their transmission, and deaths, improve the health system, and mitigate the negative impact of COVID-19, and ultimately stimulate socio-economic recovery. The core strategies have been divided into 5 strategic pillars. First, prevent by engaging and mobilizing the general public to limit exposure and transmission. Second, to detect by quickly identifying close contacts, suspected and probable cases. Third, isolate by efficiently isolating communities and segregating individuals that tested positive. And treat by providing quality health care to COVID-19 patients, including critical care and management, and then recover by attaining business and service continuity. Now, I would like to highlight key areas in which international cooperation is needed. The COVID-19 pandemic has revealed our vulnerability to emerging and re-emerging infectious diseases. It has highlighted the need for a coordinated and harmonized global response. COVID-19 will not be the last pandemic. Thus, the future must emphasize effective international cooperation with due consideration to equitable access to resources and information. We need to adapt and expand our perspective on health-related issues globally and adopt certain global mechanisms to create the greatest impact locally. Taking into account these global perspectives, areas of cooperation related to the 5 strategic pillars can be explored. The COVID-19 pandemic has revealed the need for the development of risk assessment tools and mechanisms that would serve as early warning and alert systems in order to facilitate the transfer of necessary information, including risk levels. Prevention of pandemics in the future also hinges on successful supply chain connectivity and equitable access to vaccines, which are important global public goods. The Philippines also sees capacity building for disease surveillance and further support to the national and subnational laboratory network system through health partner support as key to enhance further detection capacities. Capacity building and technical support can be provided through improvement of information systems, human resource capacity, and quality management, among others. The COVID-19 pandemic also pointed out the Philippines' close link with the world. Therefore, isolation measures must also take into consideration the need for international cooperation in the movement of people at various points of entry. Furthermore, it also highlighted the multi-sectoral nature of health and the need to capacitate law enforcement authorities and provide them with sustainable links to public health authorities. The Philippines also looks forward to playing an active and supportive role in the research and development of treatments for COVID-19. It will be creating linkages with partners from other countries and the private sector in making these treatments safe and accessible. Since COVID-19 pandemic disrupted the health systems, derailed much-needed health reforms in the Philippines, and ultimately has exposed the country's need for new approaches, there is a need to undertake coordinated exchanges of information and technology towards recovery and building a resilient Philippine health system. Cross-cutting areas for international cooperation will have to consider trade connectivity and directions of global trade. More specifically, how global public goods, including important health technologies, are exchanged. Ensuring access to these global public goods will also need cooperation and complementation of efforts from both the public and private sectors. We therefore need to provide opportunities for broader engagement between these sectors. Interconnectedness at the global scale, particularly in terms of trade and travel, is also connected to global health security, which is anchored on protecting the health and well-being of the whole population. Given the effects of the pandemic, the Philippines, being one of the countries with large population overseas, need to strengthen its international linkages to upscale its migration policy and migrant health program. This is to specifically protect one of the most vulnerable sectors of our population. This ends my presentation. Thank you very much for your attention.
Hello, good morning. This is Dr. Penina Oberdorfer, and just would like to thank all organizers to invited me to join the session. My position is the head of the Division of Pediatric Infectious Diseases, Department of Pediatrics, Faculty of Medicine, Chiang Mai University. I'm from Thailand. And thank you very much again for my sharing today. The topic is safety strategies and management of COVID-19 in Thailand. I would like to talk about the learning from the public and private health sector, and in case that we can discuss and in the real situation, that would be great. There are 7 key reasons why Thailand are able to control COVID-19 successfully. Firstly, we have the training courses in epidemiology and awareness of outbreaks of diseases. So we got the training courses in the university level and postdoctoral level courses as well. And secondly, our infectious diseases experts who are working in Thailand, actually, they are more experienced as in Thailand for a long time. Basically, they have a sixth sense to deal with our diseases. Thirdly, we follow the regulations for controlling infectious diseases in Thailand, including for the COVID-19. So we have the committee to make the regulations to control the disease. Fourthly, we have the senior experienced role models of epidemiologists and clinicians who used to work in the field for a long time as well. Fifthly, we are very well-equipped team who work and serve in the field under the standard system. And the teams consist of epidemiologists, healthcare workers such as doctors, nurses, technicians who work in the laboratory setting, and also local trained volunteers who work in the field as well. They work in the villages and they have been close to the people in the field. So this is the key of success as well. So this kind of group of people, they are not actually in the career of healthcare workers, but they are normal people who volunteer to work in the field, and they know people in the villages. They can detect the new cases, they know what's going on in the field, and then they report the cases or suspected cases to the hospitals. Fifthly, actually this is a good thing that I would believe that Thai people in general follow the regulations and strategies for controlling and preventing COVID-19 as well. So they follow the regulations of controlling the COVID-19. And lastly, we implement evidence-based medical strategies before or instead of politically motivated strategies. It means that we let the medical team walk in front of the politicians. This is a key of success as well, that actually we work along the way together, but the politicians also follow the guidelines of medical teams. As I said, that in Thailand we follow the advice by WHO on how to control COVID-19. So we follow the standards regulations such as frequent hand washing, social distancing, and using masks. We also encourage people to stay at home when they are sick. We follow standard strategies for specific places such as schools, hospitals, and shopping centers. The real-life practice at our private hospital is determined by the regulations of the Thai Ministry of Health. These regulations can be summarized as follows. Firstly, screening procedures at the high-risk groups for COVID-19 with symptoms of fever, cough, and sore throat. At our private hospital, we provide negative pressure rooms for both outpatients and inpatients. Secondly, laboratory PCR tests. One test costs around $100 and we can perform a test twice a day for around 100 specimens. Thirdly, if a person is under investigation, which we call PUI, we also provide admission rooms at the hospitals, and they will be taken care by the medical teams closely. Fourthly, for the diagnosed COVID-19 cases, we then transfer the cases to public hospital that has more potential to for the service of looking after the COVID-19 patients. In Chiang Mai, we have the Nakhon Ping Provincial Hospital, which is the main hospital, as well as the university hospital as well. In my opinion, as I am the expert in both public and private sectors, I would believe and I would trust that people here in Thailand, we follow the regulations closely. And as the medical teams, we are ready for prepare for any travelers from Korea as well. Since you know that we have a lot of direct flights from Korea fly to Chiang Mai every day, and many flights as well. So I believe that we have the good regulations and control, and as long as that we both understand one another, and we would like to also encourage all people to follow the same regulations, the same guidelines, and then we can have the safety strategies to control COVID-19. And in my personal experience, the way to protect yourself and keep yourself healthy is the key things as well. We need to look after ourselves, get vitamin C, vitamin D, for example, good supplements and good food for yourself. This is the key main to boost your immunity as well. And I would like to maybe talk more at the session when we meet. And again, I would like to thank the organizers, and thank you very much for get me to share in this session. And I see you again. Thank you. Bye-bye.
Good afternoon, ladies and gentlemen. I'm very delighted to be here and speak at Post-COVID-19 Public Diplomacy Forum. And I appreciate to Ambassador Jae-bok and Bang No-byo, former Ambassador, Minister of Foreign Affairs, to invite me. I'm Jae-bok Choi, a professor of College of Medicine, Korea University, president of the Korean Society of Global Health. The topic of today's presentation is to share my opinion on the urgent need for international cooperation to COVID-19 pandemic. I'd like to start with the share my slide. Okay. I'd like to start with the situation of COVID-19 pandemic globally. Currently, the third big wave of the COVID-19 pandemic appears to be beginning worldwide. The resulting death rate is still threatening as well. In some countries in Central Asia, such as Uzbekistan, Kazakhstan, Kyrgyzstan, and Turkmenistan, the control of early corona infections was able to the effectiveness from the policy of border and social lockdown blockade. However, since July, the number of patients and deaths has been increasing as social blockade and social distancing have been eased. Fortunately, in the case of Uzbekistan, as can be seen in these data, the confirmed cases and mortality among these countries is quite managed well. I'd like to say the world is facing a third big wave of the COVID-19 pandemic. Economies are in a deep and growing crisis. Inequalities, poverties, and hunger are rising within and among countries. This crisis could be the worst since World War II, and the economic ramification could be similar to those of the Great Depression in the 1930s. The choice between death and the economic collapse is really no choice. The only viable option for all society is to build effective public health systems that can contain the pandemic, which could even allow business to operate. Although it may be almost impossible to find the first infected patient in pandemic, immediate and strong quarantine measures and social distancing program are very important in the early stage of the spread of infection. It is well known that the implementation of social distancing policy is expected to flatten the peak of infectious disease and delay the spread of the infection. The implementation of a strong and immediate social distancing response gives time to the healthcare service system and quarantine authority to get ready to fight against the COVID-19 pandemic actually. In Korea, it is managed and well managed and controlled at the level of about 100 new cases daily and a mortality rate of 1.6% in average. On the June 13th, the SDGs and COVID-19 report released by the University of Cambridge and the Jeffrey Sachs groups and SDSN and read the global evaluation performance, especially regarding the response to COVID-19. According to the report, Korea was evaluated as a country, actually the top ranking, with very good performance in responding to COVID-19 among OECD countries. And in particular, performance indicators such as the death rate per million people, epidemic control efficiency, and degree of social mobility restrictions are very good the performance indicator compared to other OECD countries as well. I'd like to share my opinion and recommendation to COVID-19 pandemic. Before I come to the conclusion, I want to talk about things. The first is the importance of global health cooperation on the COVID-19 pandemic, which is also the theme of the forums. The controversy of the policy of herd immunity and social distancing, which is being discussed in the context of the perspective of some developed country, the United States and the European country actually, is difficult to accept in the international community, mostly low and middle income country actually. it is also difficult to determine which countries or policy will be the final winner after the end of the COVID-19 pandemic. As a consideration for such evaluation, not only the number of confirmed cases and deaths per population, but also the magnitude of health damages due to non-corona diseases is important. But ultimately, the violation of basic rights of the people, such as human rights and freedoms, and the damage of social solidarity, etc. So I think it will be very complicated and difficult. As we all know well, it's an unavoidable reality. The most strict social distance policy aggravates the socio-economic impact and equality in health in the country levels, and the long-term social distancing cannot be sustainable during COVID-19 outbreak. As you can see in this slide, public health measures such as testing and epidemic investigation are important in the early stage of infection, especially, but the intersectoral approach based on social consensus become important after the mid-term of infection stage. So I'd rather say it is necessary to make harmonization between quarantine policy, including the herd immunity strategy, based on scientific background, and social distance policy based on social consensus as well. So approach to the international collaboration to COVID-19 pandemic, we should focus on especially at the moment, that there is specific action should be implemented to raise global health security and support mid low income countries to COVID-19 and after pandemic as well. The first, we should assess response capabilities of mid and low income countries in terms of testing, tracing, and treatment, and figure out what would be the best way to support. And to provide the financial support to those countries which cannot implement social distancing due to socio-economic laws. Lastly, we should organize global health alliances among mid and low-income countries to establish systemic and effective responses against infectious disease. I would like to introduce the urgent need of regional cooperation to COVID-19 pandemic. Actually, these are prepared by the WHO and some expert groups, and including me. The first, the disseminated best practices and strategies for fighting COVID-19 adopted in the East Asia and the Pacific region, including the South Korea as well. So we could do using the ODA project, bilateral or multilateral delivery way will be fine. And the second one is we should strengthen the financing mechanism for developing countries with the cooperation with the IMF and World Bank and ADB, etc. And we should address the hunger hotspots. Actually, the hunger hotspots and the poverty was becomes a great importance during the worsening of the COVID-19. The Office of the Coordination of Humanitarian Affairs and the FAO and World Food Program we should cooperate with that international organization to cope with the hunger hotspots programs. And we should ensure social protection, and we also focused on the promote new drugs and vaccines with using the financing R&D for COVID-19 drugs and vaccine is an urgent global public good. So we have experienced it with many lessons and learned from during the early stage of the COVID-19 pandemic. For example, lack of information and understanding on COVID-19, such as the effectiveness of masks airborne transmission issues, and asymptomatic patients, and the lack of the social consensus on COVID-19 framework and measures, and also the lack of the medical responses and treatment, including vaccine. It's actually it was a big uncertainty to respond to COVID-19 effectively, especially in the early stage. As presented in this slide, I would like to propose a regional platform for urgent response to outbreak of a new infectious disease. I think that if it is developed based on the Korea's experience and lesson learned, and especially taking into account Korea's information communication technology related with our achievement, we could build a regional platform for emergency response to infectious disease. In addition, these regional platform could be spread and share this platform model in countries where the local languages and the political and economic and social system is similar in their blocks. So it is another expected outcomes of the regional platform for COVID-19 response. So thank you for listening. Thank you.
Здравствуйте, уважаемые участники конференции. Я Лазис Туйчиев, ректор Ташкентской медицинской академии. Это крупнейший университет в Узбекистане, который на протяжении 100 лет подготавливает медицинские кадры для нашей страны. И в период пандемии Ташкентская медицинская академия была на главных ролях по борьбе с этой инфекцией, по предоставлению медицинских кадров, по разработке политики и протоколов лечения. И на сегодняшний день Узбекистан имеет свой собственный оригинальный опыт борьбы с пандемией. Конечно, ни одна страна не имеет единого рецепта, который может полностью одолеть последствия коронавирусной инфекции, как на здоровье населения, так и на экономику страны. Тем не менее, мы считаем, что опыт Узбекистана очень важен, и он сыграл свою положительную роль в развитии нашей страны. Разрешите представить мою презентацию. Нашу презентацию мы назвали «Узбекистан – это адекватный ответ на пандемию COVID-19». Как вы знаете, Узбекистан является одной из самых крупных стран Центральной Азии. На сегодняшний день на нашей стране проживает более 34 миллионов человек. И те показатели, которые мы добились за период независимости, они впечатляют. В частности, с 1991 года по сегодняшний день уровень общей смертности сократился на 20%. Материнская смертность более чем 3-4 раза. Младенческая смертность почти в 4 раза. И на сегодня Узбекистан имеет централизованную систему оказания экстренной медицинской помощи, первичной медицинской помощи, которая является абсолютно бесплатной для населения, а также расширяются возможности специализированной медицинской помощи. Если мы будем говорить о появлении коронавирусной инфекции в Центральной Азии, как видно на слайде, в Узбекистане первый случай был зафиксирован 15 марта 2020 года. Это немного позже, чем в Казахстане. И на сегодняшний день мы можем показать такие цифры сравнительные, как нахождение Узбекистана на втором месте после Казахстана по числу выявленных случаев. У нас уровень смертности является одним из самых низких, как в Центральной Азии, так и во всем мире. И очень важно, когда страна адекватно реагирует на появление такой инфекции, как коронавирус. В частности, вы видите на слайде, в Узбекистане были предприняты беспрецедентные меры, которые были направлены на изоляцию пациентов, на предотвращение новых случаев заражения и таким образом сохранение здоровья населения. В частности, в первый же день обнаружения вируса у одного из жителей города Ташкента были отменены все массовые мероприятия, все праздники. С 16 марта, то есть на следующий день после появления первого случая, были отменены автомобильные и воздушные направления, связанные с иностранными государствами. С 19 марта также были отменены железнодорожные поездки, связанные с зарубежными странами. И далее, день за днем, постепенно отменялись все мероприятия, которые могли проводиться до пандемии. В частности, были закрыты все общественные заведения, такие как кафе, рестораны. Также все мероприятия, которые были запланированы на уровне государства, на уровне учреждений, или семейные мероприятия также были отменены, в том числе свадьбы, семейные праздники. А с 30 марта в Узбекистане был объявлен полный карантин, который включал в себя запрет на использование собственных автомобилей, выхождение на улицу без особых случаев. И этот карантин, конечно, возымел свою силу. В данном случае еще надо сказать, что были закрыты все школы, все университеты, все дошкольные учреждения. Наши студенты перешли на дистанционный уровень образования. И, как вы видите на слайде, были созданы специальные посты по дорогам, которые очень строго контролировали езду на автомобилях и хождение населения на улице. В Узбекистане из-за пандемии было введено 2 карантина. Первый карантин длился с 30 марта по 8 мая, а второй карантин длился с 10 июля по 11 августа. Результаты данного карантина будут показаны далее на наших слайдах. Что же было сделано параллельно с введением карантина? Была создана специальная республиканская комиссия во главе с премьер-министром Республики Узбекистан для принятия стратегических решений, направленных на сохранение здоровья населения и предотвращение масштабного распространения коронавирусной инфекции. Также был создан штаб, межведомственный орган, возглавляемый главным государственным санитарным врачом, для выдвижения эффективных мер по предотвращению масштабного распространения коронавирусной инфекции. При заместителе премьер-министра Республики Узбекистан был создан еще один штаб. Он был направлен для комплексной организации лечения и консультаций пациентов с COVID-19. Ведущие зарубежные специалисты привлекались к работе этого штаба. А также был создан специальный научный совет экспертов по борьбе с коронавирусом при Министерстве здравоохранения Республики Узбекистан. Он состоит из основных научных специалистов Узбекистана в различных областях медицины, в том числе из сотрудников Ташкентской медицинской академии. Целью Совета является разработка научных рекомендаций по повышению качества ухода за пациентами и мер по борьбе с коронавирусной инфекцией. Параллельно с этим были организованы современные медицинские комплексы для лечения больных COVID-19, а также для изоляции контактных лиц и лиц, пребывающих за границей. В частности, в Ташкентской области был создан современный лечебный корпус, расположенный на 33 гектарах земли, состоящих из 4 лечебных блоков. При необходимости этот комплекс может одновременно принимать до 4000 пациентов. И общая стоимость этого проекта составила более 50 миллионов долларов США. Кроме этого, большое количество больниц и медицинских центров в городе Ташкенте и в региональных центрах были перепрофилированы для лечения пациентов с COVID-19. В то же время в городе Ташкенте, где наблюдалось наибольшее количество пациентов с COVID-19, было открыто 5 отдельных медицинских центров, распределительных больниц на различных крупных территориях, где пациенты могут получить неотложную медицинскую помощь и полное лечение. Таким образом, в городе Ташкенте на базе этих 5 отдельных медицинских центров организовано более 4200 коек для больных с COVID-19. Надо отдельно остановиться на лечении пациентов с коронавирусной инфекцией. Дело в том, что в первые месяцы появления больных наши специалисты пользовались комбинацией гидроксихлорохина и азитромицина, а также различными другими специфическими препаратами. Но с учетом собственного опыта и результатов исследований, которые были проведены за рубежом, наша терапия и наш подход к лечению больных значительно изменился. И на сегодняшний день, вот начиная с сентября месяца, практически каждый больной с подтвержденным диагнозом коронавирусной инфекции получает специфическое лечение либо фавипиравиром, либо ремдесивиром. Для адекватного ответа со стороны правительства на потребность населения и в целях его поддержки был запущен ряд проектов. Первое – это телемедицина. То есть мы благодаря возможностям наших специалистов, а также привлечению иностранных специалистов, у нас получилось консультировать больных, находящихся в любом регионе нашей страны, которые нуждались в консультации. В частности, к этому были привлечены более 150 зарубежных ученых, которые приехали к нам в Узбекистан для оказания практической помощи. Воспользуясь случаем, я хочу поблагодарить наших друзей, коллег из Кореи, Китая, России, Германии, Турции и других стран, которые всеми силами помогали нам в консультации и лечении наших пациентов. В частности, одним из первых, кто откликнулся на призыв Министерства здравоохранения, был профессор Jae-bok, который в марте месяце по официальному приглашению Министерства здравоохранения на постоянной основе вел консультации наших больных и внес свой значительный вклад в разработку наших клинических протоколов по лечению COVID-19. Вместе с этим был создан специальный канал по Telegram, который предоставлял населению Узбекистана полную информацию со дня первой регистрации случая COVID-19 под названием «Коронавирус-инфо». На этом канале публикуется ежедневная статистика, предоставляется полная информация о мерах, реализуемых в стране, транслируются выступления официальных лиц, публикуются советы и отчеты, касаемые лечения коронавирусной инфекции. На сегодняшний день в этом телеграм-канале зарегистрировано более 1 миллиона человек. На базе Ташкентской медицинской академии мы организовали телеграм-бот-канал, где каждый желающий может при необходимости получить консультацию онлайн через телеграм-бот, а также были организованы колл-центры, которые отвечали на вопросы как по лечению, по ведению больных, по состоянию различных регионов, получению социальной помощи, консультации, психологической поддержки и так далее. Надо отметить, что со стороны государства оказывается очень мощная социальная помощь. В период карантина была организована социальная помощь уязвимым слоям населения, а также всем, кто обратился за данной социальной помощью. Всем предпринимателям и предприятиям, пострадавшим от пандемии коронавируса, правительство предоставило возможность получить налоговые каникулы на период строгого карантина. Государственная поддержка производства стратегических важных товаров, она подтвердилась выделением льготных кредитов для таких производителей, как производители медицинских масок, перчаток, лекарственных препаратов, медицинского оборудования, а также были введены таможенные преференции для полного обеспечения страны высокотехнологическим медицинским оборудованием, лекарствами и медицинскими комплектующими. Теперь несколько цифр. Как вы видите на этом слайде, во время объявления карантина, это с марта по июль месяц, показатели по заболеваемости были значительно малые, и это напрямую было связано со строгими карантинными мерами. Но в дальнейшем, вот и до сегодняшнего дня, при постепенном снятии карантина, мы видим резкое увеличение количества пациентов с COVID-19, но при этом надо особо отметить, что уровень смертности больных остался на самом низком уровне. Это все благодаря той политике, которую проводит наше правительство, и усовершенствованию наших клинических протоколов по лечению и ведению пациентов. Узбекистан характеризуется тем, что большинство пациентов были зарегистрированы в городе Ташкенте и в Ташкентском регионе, но тем не менее на сегодняшний день мы имеем такие цифры, как 95,5% наших пациентов, они уже вылечились, и на сегодняшний день в госпиталях нашей страны получают лечение 2338 пациентов. И надо сказать, что на сегодня правительством регулируется всего несколько карантинных мер. Это те меры, которые имеют свое воздействие во всем мире. Это ношение медицинской маски, это сохранение социальной дистанции, регулярное использование средств гигиены, а также ограничения на проведение массовых мероприятий, семейных торжеств и церемоний. На сегодняшний день полностью восстановлена работа общественного транспорта, предприятий общественного питания. Эти заведения получили право возобновить свою деятельность при строгом соблюдении санитарно-гигиенических правил. Более того, в смешанной форме возобновлена деятельность детских садов, школ и ожидается возобновление офлайн обучения в университетах нашей страны. Какие же мы сделали выводы из опыта реагирования Узбекистана на пандемию? Во-первых, есть необходимость принятия незамедлительных и упреждающих мер по предотвращению раннего распространения инфекционных заболеваний. Второе. Обеспечение потенциала национальной медицинской системы по диагностике, эпидемиологическому расследованию и профилактическим мерам для реализации практических мер. Третье. Тщательная координация и реализация медицинских мер, таких как инфекционный контроль, профилактика и эпидемиологическое расследование. И, наконец, последнее. Мы считаем, что очень важна установка и работа системы принятия решений высокого уровня, которая может определить и выполнять политику инфекционного контроля на основе научных данных и мнений. На этом я заканчиваю свою презентацию. Спасибо вам всем за внимание.
First of all, I would like to thank the 5 presenters for their excellent presentation in our first session. In this session, prominent experts from Philippines, Thailand, Uzbekistan, and Korea explained each country's specific responses to coronavirus crisis and presented constructive ideas on how to cooperate in the pandemic with other countries, especially with Korea. Dr. Youngmee, who is a member of WHO COVID-19 IHL Emergency Committee, gave us detailed information on Asia-Pacific strategies for emergency disease threat and pointed out important lessons from the COVID-19 crisis. In particular, she emphasized that public-private partnership and international solidarity and collaboration are key success factors for responding to the COVID-19 pandemic. Dr. Mario VILLAVERDE, the Undersecretary of the Department of Health of the Philippine government, introduced a quote, coordinated operations to defeat epidemic, and unified strategy to the COVID-19 and its 5 pillars such as prevent, detect, isolate, treat, recover. He also emphasized the importance of international cooperation and public-private partnership in coping with the COVID-19. Dr. Penia Oberdorfer, a professor of Chiang Mai University, explained us the 7 key reasons why Thailand successfully controlled the COVID-19. I especially agreed with her point that Thailand has been successful by stressing evidence-based medical strategy instead of politically motivated one. The experienced health experts in Thailand seems to be coping well with the COVID-19 according to the advices of the WHO and instructions of the Thai Ministry of Public Health. Professor Jae-bok of Korea University College COVID-19 pandemic, in terms of financial and organizational assistance from the Global Health Alliances among mid and low-income countries. He also emphasized that Korea is making efforts to build a regional platform based on Korea's experience and IT technology. Lastly, in the session, we had a remarkable presentation by Dr. Rajesh Tuichev, Director of Tashkent Medical Academy of Uzbekistan. He explained in detail how Uzbekistan has coped with the COVID-19 in practice. He stressed out the importance of securing the capacity of national medical system as well as installing and operating effective high-level decision-making system. We have been realizing the critical significance of international cooperation in the wake of the unprecedented COVID-19 crisis. I expect the meaningful cooperation among Korea and Central and Southeast Asian countries to be strengthened in near future. Thank you all presenters and online participants, and hope you have enjoyed this session. We'll have a very short break and start our session 2 in 5 minutes. Thank you very much. let's start session 2. While we have discussed the topic in general public policy level, the second session will be more focused on the role of public-private partnership, especially in health industrial cooperation among Asian countries. The keynote presentations are delivered by Dr. Choi Yeon-hee, Senior Research Fellow of the ICT and Emerging Industry Research Division at Korea Institute for Industrial Economics and Trade. And then by Dr. Yoon Tae-young, a Principal Researcher at Korea Health Industry Development Institute. Responding to these Korean presentations, two Indonesian presenters will share with us the useful information, Indonesian experiences, and their ideas. They are Dr. Tri Yunis Miko Wayono, who is the head of the Department of Epistemology at University of Indonesia, and Dr. Jimmy Susanto, Business Development Senior Manager of Kalbe Pharma, a well-known big pharmaceutical in Indonesia.
Hello everyone, my name is Uni Choi and I'm a policy researcher of KIET, Korea Institute for Industrial Economics and Trades. I'm in charge of bioindustry policy in Korea. Today I'd like to introduce the Korean bioindustry and I also suggest some cooperation measures in Asian region. First of all, I'd like to start my discussion while introducing the global status of bioeconomy. In this slide, you can see the definition of bioeconomy. OECD released a report on bioeconomy to 2030. In that report, OECD predicted the application of biotechnology to primary production, health and industry could result in an emerging bioeconomy where biotechnology contribute to a significant share of economic output by 2030. As you can see in the picture, the year of bioeconomy is coming, while increasing the national benefits and utilities from bioindustry sectors. The bioindustry can be divided into three sectors: red bioindustry, green bioindustry, and white bioindustry. And the bioindustry is implemented based on the innovation and convergence of biotechnology and other high technology like nanotechnology, etc. There are many global trends affecting the advance of bioeconomy, which are global aging, disruptive technological innovation and convergence, and the proliferation of bioinformation. Along with those global trends, the global healthcare market is rapidly expanding in response to socio-economic environmental change and needs. In the table shown in this slide, you can see the rapid market growth in every healthcare sectors, and especially in vitro diagnostics and digital healthcare sectors are growing rapidly. Therefore, there is severe competition around the world to secure competitiveness in bioeconomy. All the countries around the world are making competitive efforts to implement bioeconomy to solve future problems such as national burden in the age of aging. We are trying to find ways to save financial efficiency through convergence between biotechnology and AI. We are expecting the bioindustry as a key growth engine will lead global economic growth in the future, either innovate the healthcare system and improve the efficient production of food and natural resources, and also develop new energy and environmental products. Now let's look at the competitiveness of the Korean bioindustry. Here you can see the history of the Korean governmental policy for promoting bioindustry. The Korean government's strong policy drive began in the early 80s. The recent major policy measure is the announcement of the third National Framework Plan for promotion of biotechnology, so-called Korea Bioeconomy Initiative to 2026. In the plan, the Korean government announced expanding national investment to realize the bioeconomy by 2026. The Korean government has fostered the bio industry as a growth engine while actively expanding R&D investment. From 1994, when the first National Framework Plan for Promotion of Biotechnology was established, the investment amount of government R&D project has increased to a CAGR of 17.4% until last year. Also, as of 2019 last year, half of the R&D investment in the Korean bioeconomy is from the government and half is from the private sector. In May 2019, Biohealth Industry Innovation Strategy was announced to focus on national key industries. Major goal of the strategy is promoting people-centered innovation growth in 5 ways, which is the development of the biohealth industry, overcoming rare and incurable disease, expanding people's healthy life, increasing economic vitality, and also creating jobs. The core tasks include establish 5 big data platforms, raise government R&D investment to 4 trillion Korean won, and improve regulations on review and approval process, etc. Another important policy measure recently announced is the legislation on the safety and support of the high-tech regenerative medicine and advanced biopharmaceuticals, which was passed the plenary session of the National Assembly in August last year. We have several governmental agencies and offices, including Ministry of Science and ICT, the Ministry of Trade, Industry and Energy, and the Ministry of Health and Welfare. They are working in close partnership to foster the bioindustry in Korea. Also, and most importantly, Korea has many capable research institutes in public and private sectors. Those institutes are performing world-leading R&D in the field of biotechnology. We have several bioclusters in Korea. Of those several biohealth clusters, Osong has a concentration of healthcare-related governmental institutes, such as KFDA, KCDC, KHRDI, KHIDI, etc. Thanks to those active policy support, the Korean bioindustry has been continuously growing. The production CAGR between 1994 and 2018 is 18.6%. Also, Korea bioindustry have some potential of technology commercialization. You could see that a series of successful special IPOs by some Korean biotech companies. Out of 61 specially listed technology companies since 2005, 51 are biotech companies. Also, among top 20 Kosdaq listed companies based on market capitalization, 10 are biotech companies. A large scale of biotechnology export is being further accelerated. Technology export over 6 years from 2013 are estimated around 11 trillion Korean won. Korea is considered to have a competitive edge in biopharmaceutical production. Korea is the world's second largest biopharmaceutical producer, producing more than 60% of the world market in the biosimilar drugs. I hope you have heard the Celltrion and Samsung Biologics. Those are the representative companies. Also recently, Korea leads the world in the development and production of COVID-19 virus diagnostic kits. Since the occurrence of COVID-19, export of diagnostic devices and hygiene products surged, and the Korean biopharmaceutical export continued to expand, recording the 6th largest export rank by industry. Also, the competitiveness of vaccine and drug development against the COVID-19 is strengthening in Korea. I can tell the Korean bioindustry have potential to become globally competitive. We have superior talents in commercial development. Also, we have high quality manpower. And Geographically, Korea locates at the gateway to the world market. Lastly, let's think about the policy implication and future challenges for the cooperation in Asia. From a policy perspective, we must consider both the domestic and global market together. Of course, local company will be indispensable to enter the global market due to the limitations in the domestic capability. Therefore, it is necessary to support policies for companies to enter global market. However, we all know that it is not easy to enter the global market without trust in the domestic market. Due to the nature of bioproduct and services, where safety is very important, global market require data from the domestic market. Therefore, the strategy for domestic and global market needs to be balanced. Also, we have to understand the characteristics of the bioeconomy. There is no limit on time and place, and we need to foster convergence between various technologies. So with Asian networking, I think we can overcome the limitation on domestic supply capacity and secure the critical mass of demand. At the same time, local people should also enjoy the benefit of innovative products and service. Therefore, I like to suggest 3 policy goals. Firstly, we need to expand the local benefit of innovative products and services. Secondly, we have to support entering the global market based on trust in the domestic market. Thirdly, I like to suggest the construction of Asian bio big data platform as a sharing infrastructure. In particular, I like to emphasize to establish an Asian network to overcome the limitation of data scale. Also, we need a strong cooperation against the non-technical barriers. For example, policy efforts for harmonizing the regulation system related to R&D and licensing for drug and medical devices is very important. We also need a cooperation for technological and industrial competitiveness. I like to suggest 3 sectors we can cooperate in the Asian region. First one is the healthcare system. It is necessary to settle down the smart healthcare system in Asia to improve the effectiveness of healthcare system. At the same time, we need to promote the technological convergence between biotechnology, IT, and AI. Second sector of cooperation I like to suggest is in the area of prevention and precision medicines. We need to cooperate to secure competitiveness in developing treatment for infectious and incurable disease. Third sector we can cooperate is the quarantine system. Korea's quarantine system capability have improved a lot while experiencing infectious diseases such as MERS and COVID-19. And Korea's experience can be shared with the Asian countries. I hope my short presentation helps you on understanding on the current status of Korean bioindustry. I strongly believe that Asian countries have the great potential for the bioeconomy. I like to wrap up my talk while hoping Korea and Asian countries work together to achieve the global and local bioeconomy. We could share our technology and human resources to dominate the global market. Thank you for the attention.
Hello everyone, my name is Youngmee. I work for KHIDI as a principal researcher in Korea. I will be really happy if this presentation can give any kind of help our future cooperation. Okay, let's get started. Today, I will introduce you to K-quarantine and global cooperation cases. First, I will introduce you to what kind of organization KHIDI is. KHIDI stands for Korea Health Industry Development Institute, and it is a government-owned organization established in 1999 to promote the health industry and develop health services. As shown in the organization map of KIDI, many departments are implementing tasks related to medical devices. but especially medical device support team and the global health expansion team are often doing jobs for COVID-19 and international cooperation, which is related to medical device industry. KHIDI is performing 4 important tasks: policy research and development, R&D support such as allocating R&D fund, health industry development support, and global cooperation. Now I'm going to talk about COVID-19 status and K-quarantine. As you all know well, these charts show the current status of COVID-19 in Korea and the world. In Korea, we had the first patient diagnosed with COVID-19 on January 20th. As of October, over 20,000 people tested positive across the country. Meanwhile, globally, since the first case of COVID-19 was reported in Wuhan, China on January 10th, the number has gradually increased to over 44 million to date. Many countries are saying that Korea is taking proper quarantine measures against COVID-19, but I guess we are actually not providing 100% perfect medical services and management because of lack of facilities, manpower, and burnout staffs, etc. And also medical staff safety is a serious issue now. This page shows the policies of other major countries in tackling COVID-19. First, the USA enacted the National Defense Goods Production Act to secure scarce medical supplies. FDA is also implementing the emergency use approval for diagnostic kits, etc. The EU is imposing restrictions on the export of medical resources such as facial masks outside the countries, and sharing European standards such as CEM for shorter manufacturing and evaluation time. Japan announced an emergency declaration for 7 regions and established economic countermeasures to invest 108.2 trillion yen. Finally, Brazil is enforcing a special law which is legislated to exempt medical supplies from tariffs and regulatory agency approvals. In this serious situation caused by COVID-19, the world paid attention to the excellence of Korean diagnostic devices and medical devices such as mechanical respirators, patient monitoring systems, infusion pumps, and protective products, etc. And there are huge demands from other countries exploded. There is especially the export of in vitro test kits till August this year was 3 times higher than the export amount for the whole 2019. US FDA classified the Korean products approved for emergency use into the 3rd level group out of the 13 levels, besting global diagnostic device manufacturers such as Roche and Abbott. FIND is a non-profit global organization leading the development and supply of diagnostic devices through cooperation with WHO. According to the FIND report, products of 5 Korean companies such as Bioneer, Bodytech Med, KH Medical, SD Biosensor, and CGen have high precision with more than 90% clinical sensitivity and specificity. In order to protect the medical staff from infection and prevent its spread within hospitals, Korea devised the world's first drive-through testing system for drivers and walk-through system for pedestrians. The introduction of these new testing systems drew the world's attention to the Korea healthcare system. The first picture is the photo taken when the president of Kazakhstan visited a Korean-type drive-through testing station in Kazakhstan. It is a good case of Korea transferring its quarantine system to abroad through cooperation with the KIDI's office in the country. I'm going to elaborate about the cooperation cases more later. At this point, I want to talk about KIDI's current major cooperation and support project. KIDI is operating 6 overseas offices. Mainly driven by them, we are supporting the export of Korean companies and global cooperation. Korean government and companies are establishing the foundation for future cooperation through humane aid in the form of masks, diagnostic kits, protective clothing, etc. for many countries having difficulties to the spread of COVID-19. For example, Korea sent 388,000 PCR test kits to Kazakhstan and quarantine items such as spraying sanitizers to Indonesia. Recently, we are also trying to help Bangladesh build a Korean-type school quarantine system. Aside from humanitarian aid, we also shared our cycle know-how to tackle COVID-19, including our analysis of infectious diseases, diagnosis, treatment, and prevention of infection in hospitals, etc., with health ministry personnel and doctors and nurses across the world by opening a webinar. Over 5,000 people in 97 countries watched the web seminar. The message below on the right side is an acknowledgement from the Vice President of the Philippines. Kazakhstan is maximizing its COVID-19 test capacity utilizing the high-tech molecular analysis of CHANG, which supports diagnostic kits and special equipment and testing steps through emergency use approval for the COVID-19 testing kits. This is the result of the collaboration of a private company, CHANG, and government institutions, Kazakhstani approval authorities, and Kiri's Kazakhstani office, which presented the background and necessity of implementation of diagnostic kit emergency use for the prevention of spread of infectious diseases of the Korean government. MPK Clinic and CHANG, which are exporting their products to Kazakhstan, are also running a Korean-type drive-through testing station for the first time in the country, with the support of Almaty city government as shown by the picture on the right side. Through project supported by KIRI, a Korean rehabilitation hospital was founded in Malaysia. Staff exchange program, training of Malaysian therapists in Korea, mutual exchange of doctors are also being done. The Korean government and Uzbekistani government concluded an MOU for healthcare cooperation on August 2011 to build mutual trust, and cooperation has been extended since then. Recently, the building of a joint spine and surgery specialist hospital with 100 sick beds in Uzbekistan was supported. The hospital will transfer advanced Korean medical services to Uzbekistan to improve the success rate of surgery through precise surgery and scientific rehabilitation services. Training of Uzbekistan doctors in Korea will also be done to improve their medical skills further. To facilitate the overseas expansion of the Korean medical system, a customized support program, including discovery, market research, consulting promotion, and marketing strategy formulation for localization, and other consulting services are provided for all stages of overseas expansion by KIRI. Recently, we held a COVID-19 special virtual expo for overseas buyers having trouble finding a Korean diagnostic kit or essential medical equipment manufacturers and vice versa. We provided information worldwide along with special sessions for the development of COVID-19 vaccines and cooperation cases. Thank you so much for your cooperation. I really hope this pandemic situation can be over as soon as possible, and we try to build future cooperation to get over this hard time together. Thank you so much for your cooperation again. Bye-bye.
Thank you, Moderator. In my turn, I would like to introduce myself. My name is Dr. Philippine. I am the head of Department Epidemiology, Faculty of Public Health, University of Indonesia, and also I am an expert committee in National Task Force COVID-19. I will, in my turn, I will present about Indonesian experience in managing infectious disease, especially COVID-19. Indonesia, as you know, we have 5 big country, five big island, and more than small dozen island. We have 34 provinces and 514 districts or cities. Our population is about 270 million. We know first case COVID-19 in Wuhan, China, December 2019. After that, we still in by thermometer gun and in international big city like Jakarta, Surabaya, Batam, etc. Finally, we found the first cases in 2nd March 2020, and after that, our cases COVID-19 is rapidly spreading in around the country. Now we have already 380,000 case COVID-19, and then it is split in 34 provinces and 315 out of 514 districts. And then the infected person of COVID-19 in Indonesia, similar between woman and woman, and it is similar between male and female. For age group, the COVID cases, it is dominantly in above of 15 years of age, and then very small in under 5 children and school children. After March, the end of March, we formed the task force, the national task force, by President appointed the head of the national task force. After that, province task force formally formed, and in under the province we have district or cities, and under the district or cities we have task force in sub-districts until the village. Also meaning we all sector we work together between government and private. Also we work formal and informally, and then we work together from the village to national level. In the task we have the head of task force is appointed by president in national level. In province level, automatically governor as the head of the task force. In the district, major or cities major city become a head of task force, and in the sub-districts, the head of the sub-district, and in the village also the head of village automatically become the head of task force. We have in finance we have the 3 division, division emergency and prevention and preparation, and division rehabilitation and reconstruction. And then for the health sector, we control the disease by we have many activity in control of disease. We have activities in the health service, and also prevention of disease. We did some many things for prevention of disease, and also public intervention. We did some public intervention and environment intervention and disinfection. And also in economic sector, we did economic recovery in the agriculture recovery, industrial recovery, and so on and so on. And we give aid for property person, for medical, and for anything that they need during pandemic or during outbreak or during epidemic in Indonesia. Our strategies to against COVID-19 is detection, prevention, and response. Detection, we did the test for antibody for everyone, and then we try to the target of test. Also, we developed that from the one sick 19 and now become able to examine more than 30. The target of our country is 30,000 sample we can examine. And then for after the test, we isolate the cases, and also we testing the contact, and we quarantine the contact. And then for prevention, we did everything for prevention, control, and public health education. And as well, we have public health services and public health and also health facility. And also we develop drug and vaccine for the disease. It is the example the sector we have together between government and private in health sector. We also the private sector in health. We develop a protocol, the health protocol together. It is also in religion sector. We also develop the protocol in religion together between government and the partners. It is in food industry. We also work together between government. We develop the guidance. Also together between government and private. And it is the task force, a national task force. We doing collaboration between private and government. Also the president to have negotiation, to have coordination, to have everything. Then that was required for the task force, and also task force doing everything to cover the disease. Thank you very much.
Greetings. My name is Jimmy Susanto from Kalbe Pharma, Indonesia. I would like to first thank the organizer of the event for inviting Kalbe to present its experience in developing treatments and vaccines for COVID-19 in Indonesia. For the first few slides, I would like to quickly go through a brief introduction of Kalbe and its existing collaborations relevant to the development of COVID-19 treatments in Indonesia. So as a company, Kalbe was established in 1996 in Jakarta, Indonesia. It has been a publicly listed company since 1991. It is the largest publicly listed pharmaceuticals company in Southeast Asia with a market cap of $4.9 billion as per September 2020. At Kalbe, we have 4 major divisions covering prescription pharmaceuticals, consumer health, nutritionals, and distribution and logistics. And as you can see, Kalbe has presence in Southeast Asia, in all of the Southeast Asian countries, as well as Nigeria and Middle East. Kalbe has many international collaborations, including with prominent Korean companies such as Samyang Bio. Actually, with Samyang Bio, we've built an oncology factory with Genexin, which I'll go into for more in the next slides. Daewoo Korea and Korea United Pharma. The collaboration with Genexin in particular is an interesting one, because in January of 2016, Kalbe together with Genexin, we established Kalbe Genexin Biologics in Jakarta, Indonesia, as a drug development company focusing on immuno-oncology. The company has so far in-licensed 3 products, including high-FC EPO from Genexin, HLX10, which is a PD-1 antibody from Henlius, and CD73 monoclonal antibody from IMAB, and is currently involved in clinical development for 2 of these molecules. Now, moving on to the topic of today. As everyone here probably knows, COVID-19 is the worst pandemic that we've seen in decades. As per last week, based on data from WHO, 47 million cases has been confirmed, and resulting in 1.2 million deaths worldwide. Globally, it affects all regions of the world, with the Americas the worst hit, followed by Europe and Southeast Asia, and the trend seems to show signs of a second wave. As a result of this pandemic, economic-wise, the world is now facing its worst recession since World War II, with unemployment the highest since the Great Depression. Taken together, these data emphasizes the need for a rapid and effective response to the pandemic. If we look at the many treatments being developed for COVID-19 today, we can divide them into 2 main groups. The first is the repurposing of existing, already approved drugs and herbal medicines. This involves performing clinical trials to bring the drug to the market quickly. This group includes examples such as remdesivir, dexamethasone, immune-boosting medicine or supplement, and other antiviral drugs. For these drugs, the development path is relatively faster because the safety has been established. Most of the drug has been approved for other indications in the market. And the treatments indication for treatments, clinical trials, the indication of efficacy can be seen quite fast. Typically 1 or 2 months of observation is enough. The second group of treatments is new development, mainly involving vaccines against SARS-CoV-2. Based on the data on WHO database on November 3rd, there are 47 candidates in clinical evaluation and 155 in preclinical evaluation. There are many examples of these, such as Moderna, AstraZeneca in Oxford, Sinovac, Sinopharm, and obviously Genexin Consortium from Korea. Development in this group is a bit more challenging because they're starting from scratch, so they need to start from CMC, preclinical, phase 1, 2, and 3. Typically now we see that the strategy is to do it in parallel so that the development can be quicker and ensure the availability of the vaccines as soon as possible. Now, if we look a bit deeper at the development of vaccines for SARS-CoV-2, we see that there are 4 main types being developed: virus vaccine, this is traditional, and viral vector vaccines. The nucleic acid vaccines, these are the DNA and RNA vaccines, and also the protein-based vaccine. Development region-wise, they focus mainly in the North America, followed by China and Europe. What is also interesting from this data is also the development of vaccines are being driven mainly by the private industry, which is unusual because vaccines is usually the territory of academics and governments, because usually it's a public interest that drives the development of vaccine. At Kalbe itself, we are involved in the development of both groups. We are doing trials with our herbal drugs for their immunomodulatory properties. We've also launched remdesivir in Indonesia just last month. And we are also involved in collaboration for the development of vaccines with Genexin. Now, the vaccine candidate with Genexin is a DNA-based vaccine. It was originally announced in April 2020 by Genexin and its consortium in Korea. Back then, I think Korea was going through its worst phase of COVID-19. The vaccine is developed based on Genexin's vaccine platform, and it's targeting the spike protein of SARS-CoV-2. The vaccine platform has actually been developed previously in a preclinical setting, in an academic setting for other viruses such as H5N2, H1N1, H5N1, as you can see from the publications on the slide. And it's actually in active development for cervical cancer. Development-wise, the vaccine has completed the CMC and preclinical testing back in May. Phase 1 started in Korea in July of this year, of 2020, and recently completed in October 2020 the last observation for the last patient in phase 1. So hopefully we'll get the results of the phase 1 soon. Phase 2 is expected to start in this month, and development is expected to be completed altogether in December of 2021, with a possible interim analysis around Q2 2021 for emergency use approval. The next slide, I think this is just to highlight the collaborative nature of this vaccine development on both our end and on the Genexin's end. We both established consortiums, Genexin in Korea and Kalbe in Indonesia, involving many different members of industry, government, and universities. It's important to do this because otherwise development is difficult to be done quickly and effectively. For the next two slides, I would just like to discuss about the challenges and insights that we've come across during our time developing treatments for COVID so far. Now, COVID and pandemics in general present a unique business challenge because due to their nature, response to pandemics such as COVID-19, they must be large in scale and they must be short in time. Large doses must be manufactured in a short period and in large scale. In most cases, this means leveraging existing facilities. Building new facilities is usually not an option during pandemics as supply of equipment is lacking, and commissioning is also a challenge because travel of engineers is restricted. And this, unfortunately, was and is still a challenge in Indonesia, where existing facilities for manufacturing of vaccines are limited. Second, the development, again, must be done at an accelerated pace to meet the timeline demands. I believe for this part, the government and regulators in Indonesia especially have done an excellent job through their creation of emergency use authorization schemes and prioritized review and approvals for INDs and treatments for COVID-19. Last is regarding the opportunity to recoup costs. So when we consider the development as an investment, as a business, pandemic in general is not a good fit for the industry because the opportunity period for commercialization is limited and margins obviously are limited. This means we do not have a lot of room to take in financial risk. This is where we need accelerator funds such as BARDA in US and ACT accelerated by WHO. These help alleviate the financial risk that the industry needs to take to bring this innovative drug in such a short time frame. Which brings me to the last slide of the vaccines. I mean, from the industry standpoint, we would like to see additional facilities made available to help mitigate potential financial risk from taking on a development of new vaccines. And again, the accelerator fund like BARDA or ACT is a good example. I believe such a fund between Indonesia and Korea, if available, would be useful as well. Alignment between regulators can also be useful because the scale of trial that is required for the development of vaccines oftentimes require multi-countries to achieve the required patient number. In this case, maybe mutual recognition of IND approvals, if possible, is beneficial as well. I thank again the organizer for giving Kalbe the time to have this discussion. Thank you, everyone.
Distinguished participants, ladies and gentlemen, we have enjoyed 4 excellent presentations on the public-private partnership in health areas to effectively deal with the infectious disease. I would like to summarize the valuable viewpoint presented at the second session. First, 2 Korean experts enlightened us with very informative presentations. Dr. Choi Yoon-hee, senior researcher at the Korea Institute for Industrial Economics and Trade, KHIDI, briefed us on how the Korean bio industry has been rapidly developing, emerging as even more competitive and making Korea the second largest biopharmaceutical and high-quality manufacturer in the world. Her 3 valuable recommendations for enhancing cooperation in bio industry are very important, warranting our attention. The governments in Asia need to harmonize regulations on drug and medical devices by removing non-tariff barriers to promote mutual benefits in health. Second, trust building in the domestic bio market is essential for entry into global bio-industrial market. Third, it is highly recommendable to establish the Asia Bio Data Platform in the era of the 4th revolution technologies such as big data and AI. Now, Mr. Yoon Tae-young of KHIDI, the Korea Health Industry Development Institute, shared very valuable thoughts on how the Korean healthcare system including hospitals and pharmaceutical devices, has been well received in Asia and exported globally. The 6 branches of his institute abroad are supporting cooperative projects on healthcare system overseas. The successful examples of medical cooperation in the CHANG medical company in Kazakhstan and collaboration between hospitals in Uzbekistan and Malaysia are indeed impressive. They may lead to further practices of mutual benefits in Asia and beyond. Foreign partners may be able to develop joint projects by making full use of Korea's customized support programs, including for market research, consulting, promotion and marketing strategy, and formulation for localization and other consulting services. Third, Dr. Jae-bok Susanto, a representative of Kalbe Pharma, one of the largest bio company in Indonesia, shared us the benefit of medical joint projects for foreign bio companies, including Korean firms. We fully support his view on the need to expand further cooperative projects through the sharing of investment, market, and technologies among the private sectors of 2 countries in the area of vaccine development and healthcare system. Finally, Professor Triyuni Miko Waihono of the Indonesian University emphasized how Indonesia has been successfully controlling and overcoming the threat of a pandemic in Indonesia. It was possible with close coordination between the government and private sectors. Through the presentations, we have understood the great value and the importance of international medical cooperation at all levels, including the government, private sectors, so that practical steps could be taken to counter pandemic such as COVID-19. In this regard, we recognize the need to develop our cooperation through the continued holding of this kind of forum. It may be mutually beneficial to expand the channel of dialogues, consultations on health cooperation. It is because ultimately we only safe when all countries are safe. Thanks to the useful presentations at this forum, we are also confident that there will be greater mutually beneficial outcomes through the engagement in further cooperative dialogue among partners in Asia. We hope that such dialogues can help to identify common ground for cooperation, not just in medical health areas. We can also formulate our common stance in the social, economic, as well as security field in Asia. Thank you. Now it's time to conclude our wonderful forum on health cooperation. On behalf of all our participants in this forum, I wish to sincerely thank all those who made time to watch this forum. My deep thanks goes to all expert officials of 5 countries in Southeastern Asian and Central Asian regions for presenting their valuable views. Let me share several points in our successful outcomes of these forums. First, we found that the participant countries in Asia have been doing their best to contain and remove the threat of the pandemic with the resources and tools available to them. It was clearly shown that when national health infrastructure and treatment mechanisms are sound, it has been possible to cope with the pandemic safely and effectively. In spite of some differences in variations in countering COVID-19, we could learn each other through listening to and analyzing which measures are doing well, working well in other countries. Second, we could understand the key importance of the timely supply of medical tools and technologies to counter the pandemic and how important it is to render regional and bilateral assistance to this end. Considering the importance of a private medical sector, government may have to promote foreign investment more openly for the development of a new medicine and vaccines products. Such favorable measures would ensure our safety of life in effort to cope with the impact of the COVID-19. Third, we could recognize an urgent need to develop more effective coordinations to work out cooperative and innovative policies in health and medical treatment. In this regard, I hope for, indeed recommend, continuing and expanding the cooperation platform with wide participation ranging from policymakers, parliamentarians, experts, and business people from various sectors. We may be able to discuss and agree on practical measures for cooperation, as well as explore ways to provide substantial support for medical innovations, such as economic and social development. Such mechanisms might help us to assist each other to foster closer collaborations among the policymakers and various people in the future to ensure the healthy life for all. Many of us are wondering what the future holds, what life will be like next year. Can we return to normal life, such as traveling and enjoying close contact with each other, as in previous times? Our tentative answer to this is that although we hope for viable vaccines and treatments, it is uncertain they will be a silver bullet. Thus, given all this, it is only reasonable to say that the life in post-corona era will be quite different, even after vaccine and treatments are made available. Accordingly, we really do need to reshape our pattern of life and direction of cooperation. In the face of an unprecedented global challenge, we have been striving to limit our attention to what to do domestically against the spread of the COVID-19. So all countries focus on shutdowning, restricting the movement of people, closing borders and shops. These measures brought the disruption of global supply and distribution flow and people's traveling. But these measures are not enough as an effective response to this challenge. The pandemic is testing our resilience of global governance, particularly in the health and economic fields. So we have to upgrade cooperation in existing agencies such as WHO. We have to strengthen international health regulations by turning to a new global health agency security agenda and improving its regulations and other norms. In this connection, last May, Korean government initiated the launching of support group for global infectious disease response, so-called G4IDR in Geneva, to contribute to improving global responses against the pandemic. It is important that we work together to prevent and counter the second wave of the pandemic in coming winter. In this connection, we hope that this forum may lead to development of further dialogues among officials, medical experts, business people, and even political leaders to promote coordination against the occurrence of another such pandemic in the future. We have good confidence that the new President of the United States will support and promote even closer bond of collaboration in the medical field. So we all will be able to work together more closely to effectively overcome the pandemic. We can also expand our horizon of cooperation to Europe and other continents against the global challenges. Before closing, I wish to extend my deep appreciation for the support of the Korean Foreign Ministry in holding this forum successfully. And I deeply thank also the staff of the Asia Pacific Research Center of Hanyang University for the meticulous preparation made for this forum. My special thanks go to all those in Asia and Central Asia who have participated and watch this program, and also to our Korean friends abroad. Thank you very much.
We hope you have enjoyed today's forum. We also strongly hope that this forum will pave a way to a sustainable platform for future health medical cooperation in Asia. Thank you so much.